Welcome to Real Hope, a monthly video series by the Mississippi Department of Mental Health to share more about specific services and supports that are available in our state to help our friends, family members, and neighbors who have a mental illness, substance use disorder, or intellectual or developmental disability. Each month in our Real Hope series, we will dive a little deeper into a specific service or support.
May is recognized around the country as Mental Health Month, a time to raise awareness about mental health, fight the misconceptions that are so common, and promote the resources and supports that are in our communities. This month, we want everyone to know that our mental health is just one part of our overall health and wellness. If we want to be healthy, then we need to make sure we're taking care of our physical health and our mental health. Hi, I'm Wendy Bailey, Executive Director of the Mississippi Department of Mental Health. Mental illness is much more common than you may realize. It doesn't discriminate when it comes to those who can be affected, regardless of age, race, background, or any other circumstances. Around 1 in 5 adults will experience a mental illness each year, and almost 50% of all Americans will meet the standards for a diagnosable mental health condition at some point in their lives. That's why it's so important to be open about our mental health and have conversations that recognize how essential our mental health is. We need to all make a habit of checking in on our mental health, both with others that we know and taking time to focus on it ourselves. Sometimes the hardest part is asking that first question or taking the first step for help. But we should recognize the strength it takes to do that and the strength it takes to share your own story. Everyone's mental health journey is unique, but the strength you show in getting help and sharing your story can be the inspiration and hope for others who are struggling. I mentioned that mental health issues don't discriminate, and that's true. In addition to Mental Health Month, the first week of May is recognized as Children's Mental Health Week. It may surprise you to learn that even very young children can sometimes be in need of services. If you are a parent, caregiver, or work with young people, then you need to know the supports that are near you. Here is Linda Stewart, our Division Director for Children and Youth Services, to share more with you.
I'm Linda Stewart. I'm the Division Director of Children and Youth Services here at the Department of Mental Health. Early intervention is the key, just as with any issue. You want to reach out and get help for your child as early as possible. We offer a wide array of children and youth services through our community mental health centers and our private providers. We offer traditional outpatient services like individual therapy, community support services, physician psychiatric services, day treatment, peer support services, and crisis services. We also offer a wide array of specialized services through private providers and our community mental health centers. Some of those include wraparound care coordination, which is a care coordination process for children and youth who are at risk of out-of-home placement or who have traditionally been in and out of acute and residential care. It is a team of individuals chosen by the family that meet monthly to discuss the child's case and put in services and supports where needed. Signs and symptoms that you might want to look for in your child or youth are marked changes in their sleeping habits, their eating habits, if they are more withdrawn when they are usually not withdrawn, a loss of interest in activities. Our state is fortunate to have a crisis stabilization unit operated by Region 9 Community Mental Health Center. It's located on the campus of Mississippi State Hospital, but serves youth ages 11 up to 18 statewide. We offer school-based services through our community mental health centers and our private providers in almost every school district in the state where children and youth can be seen by the therapist and also receive other services and supports like peer support services and community support services. We also offer MyPAC, which is Mississippi Youth Programs Around the Clock. That is like a PRTF on wheels or in the home. It's a team of professionals, a prescriber, a community support specialist, a therapist, a peer support specialist that are able to provide those traditional outpatient services at a more intensive level, and they are also on call 24/7 for that child and family if needed. MAP teams are community teams that meet monthly to review cases of children and youth who are having difficulty in school or at risk of going into a higher level of care or at risk of being out put in out-of-home placement. We have 55 MAP teams across the state that are operated through our community mental health centers and one private provider. They serve around close to 1,000 children and youth each year that have serious emotional disturbance and are at risk of out-of-home placements. All of these services provide a wide array of care on a continuum to meet the needs of children from birth to 21 who are experiencing any kind of mental health issue. It can be a crisis situation, a psychotic episode, traditional mental health challenges that children experience either in school or at home. We have a wide array of services to address these issues.
In Mississippi, we have been working hard to build a continuum of care that meets people where they're at, whether that's in a crisis with a need for intensive services that help you from needing to be hospitalized, or if you just need a helping hand and support from some of your peers. No matter what your need is, reach out to the Department of Mental Health by calling our helpline, visiting our website, or by using the Mental Health Mississippi website or app. These resources can connect you with help.
By making more people aware of the resources available in Mississippi, we can ensure that more stories of resiliency and recovery are created each day.